Chapter 20: Family Constellation Therapy, Dynamic Therapy, and the Cell Danger Response. Introduction: Healing Beyond the Individual. Trauma is often seen as a profoundly personal experience, but its effects extend far beyond the individual, rippling through families, communities, and down the even generations. In the context of trauma recovery, it's essential to recognize the broader dynamics that contribute to suffering. Family constellation therapy and dynamic therapy are two approaches that focus on these extended dynamics, shedding light on how unresolved traumas from previous generations can become embedded in family systems, contributing to individual distress and chronic activation of the cell danger response, CDR. In this chapter, we will explore how these therapeutic approaches help address inherited trauma and systemic emotional burdens, and how they interact with the CDR to promote healing at both the individual and family levels. The role of inherited trauma in chronic stress. Trauma is not only personal, it can be inherited across generations. Family systems theory suggests that trauma, unresolved emotional conflicts, and dysfunctional patterns within a family can be passed down from one generation to the next. This phenomenon is sometimes referred to as transgenerational trauma. While individuals may not consciously remember the events that affected their ancestors, the emotional and physical imprints of these traumas can remain active within the family system. When transgenerational trauma remains unresolved, it can perpetuate patterns of chronic stress, emotional dysfunction, and illness. The CDR becomes an essential concept in this context, as the body's cells may continue to interpret these inherited emotional burdens as threats, keeping individuals stuck in a state of chronic defense, even if it was their ancestors who experienced the original trauma. Family constellation therapy. Unraveling generational trauma. Bert Hellinger developed family constellation therapy, which is based on the idea that unresolved family traumas, emotional entanglements, and imbalances in the family system can lead to mental, emotional, and physical problems in the present generation. This therapy allows individuals to explore how their suffering may be connected to the unresolved traumas of their ancestors. During a family constellation session, a group of people or stand-in representatives are used to recreate and represent the family system. This process brings hidden dynamics and unresolved traumas to the surface, allowing the client to see how certain emotional burdens may not actually be their own, but part of a more considerable family legacy. By acknowledging these dynamics and giving them space to be witnessed, individuals often experience a release of emotional tension and begin to heal. Family constellation and the CDR. From a CDR perspective, the unresolved traumas carried within a family system can keep an individual in a heightened state of cellular defense. The body perceives these inherited emotional burdens as ongoing threats, which lead to chronic activation of the CDR, manifesting in symptoms such as chronic fatigue, anxiety, depression, and even physical illness. Family constellation therapy helps break this cycle by identifying and acknowledging these transgenerational traumas, giving the body and cells the signal that the danger has passed, and allowing the CDR to deactivate. Family constellation therapy and dynamic therapy work on both emotional and cellular levels, helping to resolve trauma by supporting the body's transition from the CDR into salugenesis. See Chapter 7. These therapies play a pivotal role in allowing the body to let go of defense mechanisms and engage its natural healing processes. An illustrative example. Generational healing through family constellation. Consider the case of a woman named Sarah who experienced chronic anxiety and an overwhelming sense of guilt, even though she had no apparent reason to feel this way based on her personal experiences. Through family constellation therapy, Sarah discovered that her grandmother had endured significant trauma during World War II, and that this trauma had not been processed or resolved. The weight of this unresolved grief had been passed down to Sarah, manifesting as anxiety and guilt. After engaging in family constellation therapy, Sarah experienced a profound emotional release. and her chronic anxiety subsided as her body no longer perceived the inherited trauma as an immediate threat. Dynamic therapy, addressing the flow of emotional energy. Dynamic therapy is another therapeutic approach that focuses on the underlying emotional processes and patterns that contribute to mental and physical health problems. This approach is based on the idea that emotional energy needs to flow freely for optimal well-being. When emotional energy is blocked, often due to trauma or emotional suppression, this blockage can manifest as emotional distress, psychological symptoms, and even physical illness. Dynamic therapy aims to help individuals recognize and release these emotional blockages by exploring unconscious patterns, unresolved conflicts, and repressed emotions. Through this process, clients can restore the flow of emotional energy, allowing for more profound healing. Dynamic therapy and the CDR. Dynamic therapy is highly relevant to the CDR because it helps address the emotional stagnation that keeps the body in a state of defense. When trauma remains unresolved or emotions are suppressed, the body continues to perceive a threat at the cellular level. This chronic emotional blockage can lead to prolonged CDR activation, as the cells remain on high alert, unable to return to normal functioning. By addressing these underlying emotional blockages, dynamic therapy helps individuals restore their emotional balance, which signals to the body that it is safe to deactivate the CDR. As a result, the individual's physical symptoms, such as chronic inflammation, fatigue, and immune dysfunction, often improve. An illustrative example: releasing emotional blockages with dynamic therapy. John was a successful professional who struggled with chronic pain, migraines, and digestive issues that had no apparent medical cause. Despite seeing numerous specialists, he couldn't find relief. Through dynamic therapy, John explored his suppressed emotions, particularly unresolved grief over the loss of his father during his teenage years. By addressing these emotions and allowing himself to feel and express his grief, John experienced a significant reduction in his physical symptoms, as his body no longer needed to maintain its chronic defense posture. The connection between family constellation therapy, dynamic therapy, and the CDR. Both family constellation therapy and dynamic therapy are deeply connected to the CDR, as they address different aspects of how emotional trauma and unresolved stress contribute to the chronic activation of this cellular defense mechanism. Family constellation therapy helps release inherited traumas and emotional burdens that perpetuate the chronic activation of the CDR across generations. Dynamic therapy focuses on releasing emotional blockages that occur within an individual's lifetime, helping the body deactivate the CDR by restoring the flow of emotional energy. By addressing both the transgenerational and individual levels of trauma, these therapies help individuals break free from the chronic activation of the CDR, promoting healing, not only for themselves but also for future generations. Integrating family constellation and dynamic therapy into trauma recovery. To fully integrate these approaches into trauma recovery, it's important to acknowledge the role of family history. It is crucial to recognize that certain emotional burdens may not originate from the individual, but from the family system around them when resolving transgenerational trauma. Explore unconscious patterns. Dynamic therapy encourages individuals to become aware of unconscious emotional patterns that may be keeping them stuck in a state of chronic stress. Restore the flow of emotional energy. Both therapies work to release emotional blockages, signaling to the body and cells that it is safe to deactivate the CDR. Key takeaways. Trauma is not only personal, it can be passed down through family systems, contributing to chronic stress and CDR activation in individuals. Family constellation therapy addresses inherited trauma and helps individuals release emotional burdens that have been carried across generations. Dynamic therapy focuses on releasing emotional blockages and unresolved conflicts, allowing the body to deactivate the CDR and return to a state of healing. Integrating these therapies into trauma recovery helps individuals break free from chronic CDR activation and promotes healing at both the personal and generational levels. References: Hellinger, B., 1999. Love's Hidden Symmetry: What Makes Love Work in Relationships. Zeig, Tucker and Thyssen, Levine, P.A., 2011. In an Unspoken Voice: How the Body Releases Trauma and Restores Goodness. North Atlantic Books. Navio, R.K., 2014. Metabolic Features of the Cell Danger Response. Mitochondrion 16-7-17. https doi.org 10.1016/jmito.2013.8.06. Porges, S.W., 2011. The Polyvagal Theory, Neurophysiological Foundations of Emotions, Attachment, Communication, and Self-Regulation. W. W. Norton and Company. Ruppert, F., 2008. Trauma, Bonding, and Family Constellations. Understanding and Healing Injuries of the Soul. Green Balloon Publishing. Van der Kolk, B.A., 2015. The Body Keeps the Score. Brain, Mind, and Body in the Healing of Trauma. Penguin Books.